Hey, everybody. So I am going to wait and give people time to join this live because, it's only been 2 days. It's only been 2 days since information was brought to me about Ballad Health and Hey Gene and some of the things that it was planning to do with its NICU and with the trauma centers in the areas where I'm from back home. And in the last 48 hours, the information that, I have been able to uncover, that people have been able to uncover and send to me has been incredible. Absolutely 100% incredible. And what I'm about to share with you now is crazy. It's absolutely unbelievable. If you thought everything that I've told you prior to now was mind-blowing, let's just say that after this, 60 Minutes is going to want to follow up with an interview that they did previously in 2012 with Ballad CEO. We're going to have a conversation. Hey, Chris. Hey, Brian. I'm going to give you guys a minute to literally pile in here because we're going to, I don't put bombshell up if I don't mean it. So, when I started looking into Ballad Health and the merger between Wellmont and Mountain States Health Alliance, when I started looking at the COPA agreement, when I started looking at Senator Rusty Crowe passing legislation for them that allows them a loophole in their COPA, when I started looking at the fact that Senator Rusty Crowe is actually a contracted employee of Ballad Health and is having a conflict of interest by passing their legislation for them, I thought that in itself was fun, like just crazy information. Hey, Keisha. Hey, Deborah. I thought, finding definitive proof of links between politicians and corporations exchanging money and in turn for legislation and things being passed. I thought that was bad enough. But here's what I'm going to do. I'm going to clear up some numbers because Ballad Health has been putting numbers out about our NICU at Holston Valley Medical Center. They have been telling you guys that it's not a big deal to take away this NICU. They're telling you it's not a big deal to downgrade this trauma center. I'm telling you, folks, it is a big deal. And I'm going to tell you why you should not believe a single word that comes out of Alan Levine's mouth. And this might jeopardize their willingness to do the meeting with me. I did get an email, so let me put this on the record. I got an email from Tony Keck's secretary today, his assistant, and she has told me that they are willing to meet with me on December 13th. Hey, everybody. That's what they said. Now, let me say this, and I'm going on the record. I am more than willing to still meet with them on December 13th after this Facebook Live. If they choose not to, it will be totally on them, and it will be because of the information that I'm going to share with you guys right now. Okay, so here we go. Before going to Louisiana, which is where Alan Levine worked prior to coming to Tennessee, okay, he worked in Florida, and he worked for a company called HMA. HMA is health, holy geez. Sorry, I got so many things up right here. So Health Management Associates, LLC, HMA. That's the company that he worked with, that he worked for in Florida. His role there was the Senior Vice President of Health Development Operations and Governmental Relations. That was his title. So listen, Senior Vice President of Health Developmental Operations and Government Relations. So he's joined HMA in August of 2010. Okay, that's when he joined HMA, August of 2010. That date is very important to you guys. So listen, and he was there until January 2014. Okay, so here's why this is important. Here is why this is important, because on December 2nd of 2012, 60 Minutes released an interview that they did with Alan Levine. And they asked him, because there were allegations that HMA had been firing employees, that they had been fraudulently admitting patients because there was a goal to have a 20% increase in admissions. So the charge, the allegation was that the company that he was the senior vice president of had been admitting patients who did not need to be admitted. They had been pushing patients that did not need to be pushed. And he said in an interview with 60 Minutes, and he said that that is not the case, that that has not been happening. And he said that those allegations were before he began working for them in 2010. Well, here's what I got to say about that, Alan Levine. Liar, liar, pants on fire, and I can prove it. And I don't often talk smack unless I can tell you that I can prove it. And let me tell you why I can prove it, ladies and gentlemen. Because the Department of Justice, y'all heard me say Department of Justice, right? The Department of Justice released the court case against HMA September 25th, 2018. The investigation just finished and they just came to an agreement. So here's the agreement. I'm going to read you the legal document from the Department of Justice. Y'all ready for this? He lied. He lied. He lied. He lied. He absolutely was there, and it was happening while he was there. Let me tell you how I know. This was from the Department of Justice, Office of Public Affairs. This was released Tuesday, September 25th, 2018. The headline says, hospital chain will pay over $260 million to resolve false billing and kickback allegations. One subsidiary agrees to plead guilty. Did y'all hear me? Now, in case you're thinking, oh my God, maybe this really did happen before he was there. When did I tell y'all Alan Levine went to work for HMA? I told you August 2010, correct? Let me tell you when these things happened. These things happened. They are settling this. The civil settlement resolves allegations. So listen, the civil settlement resolves HMA's liability for submitting false claims between 2008 and 2012. It also resolves allegations during that period from 2003 through 2011. When did I tell you he went to work for them, folks? 2010. So Alan Levine, the CEO of Ballad Health, was allowing false, y'all hear me? I got palpitations too. I'm shaking. I'm sure I have hives. I'm all red. But here's the deal. He said on 60 Minutes and he lied, and he said that these were allegations that were false, number one. He said, number two, that they preceded his time before he arrived there. That is not true, sir. And the organization that you used to be the vice president of has agreed to pay $260 million because you all were admitting patients fraudulently. You were driving up your billing, you were driving up your costs, and you were making millions of dollars because of it in kickbacks and bonuses. And here's what's so funny about this. After this, guys, after this position, he went to work for Louisiana and he teamed up in a government position, Secretary of Health and Hospitals in Louisiana. When he went to work there, guess what he said? When he went to work there, he said, we're going to crack down on Medicaid because it's a fraudulent system that people can take advantage of. Wonder how you know that? Because you were taking advantage of it, sir. That's how you know. See, here's what you do, Alan. Here's what you do, sir. When you work in a private hospital, you take advantage of government insurance policies to pad your pocket. And then when you take a government job, you go, oh, we're going to crack down on Medicaid. That's what you do, sir. Your last job, you were cracking down on Medicaid in Louisiana, right? That was your position. Now you're enrolling Virginia people in the expanded Medicaid legislation. What did you just say? The new legislation for Virginia Medicaid will allow 400,000 people to get Medicaid. Of those, 21,000 live in Southwest Virginia. So we're going to show them how they can take advantage of this Medicaid ability. Wonder why you want to do that now? Maybe because I had a Johnson City ICU nurse message me and tell me that several months ago, when you guys were determining what trauma center you were going to keep between Johnson City and Holston Valley, you all started admitting people into the ICU that weren't ICU patients. And the nurses were told that it's because it would boost your numbers while your third party did an investigation, sir. Maybe that's why. Do y'all hear what I'm telling you? Alan Levine, the CEO of Ballad Health, sat in a 60-minute interview in 2012, and he said, we did absolutely nothing wrong. We didn't do any fraudulent stuff. We never admitted patients we weren't supposed to. He said that is not happening. And if that did happen, I would say that they should be prosecuted to the full extent of the law. Bullshit. You want to know why, sir? Because that's what you were doing. And here's what this agreement says. Listen to me. I'm going to read you. This is from the Justice Department, folks. I will put the link up. Hunter, I saw you get on here. I will send you this link, sir. Here's the deal. It says, as part of the criminal resolution, HMA entered into a 3-year non-prosecution agreement with the criminal division's fraud section in connection with the corporate-driven scheme to defraud federal health care programs by unlawfully pressuring and inducing physicians serving HMA hospitals to increase the number of emergency department patient admissions without regard to whether the admissions were medically necessary. The scheme involved HMA hospitals billing and obtained reimbursement for higher paying inpatient hospital care as opposed to observation or outpatient care from federal health care programs, increasing HMA's revenue. Let me tell you, now let me tell you why this is dangerous, folks. He's got a monopoly over 71% of the inpatient care in Southwest Virginia and Northeast Tennessee. You got a crook running your damn hospital. You mess with the wrong person's NICU, baby. That's what you did. Whew. How about that? I wonder if 60 Minutes going to want a follow-up interview. Let me go ahead and continue reading. Let me go ahead and continue reading so that you guys get this. HMA pressured emergency room physicians, including through threats of termination, to increase the number of inpatient admissions from emergency departments, even when those admissions were medically unnecessary, said Assistant Attorney General Binkowski. Hospital operators that improperly influence a physician's medical decision-making in pursuit of profits do so at their own peril. Where we find such conduct, the Criminal Division's Healthcare Fraud Unit, together with our Civil Division and law enforcement colleagues, will aggressively prosecute those responsible to the fullest extent of the law. HMA also agreed to pay $216 million as part of a related civil settlement. The civil settlement resolves HMA's liability for submitting false claims between 2008 and 2012 as part of a corporate-wide scheme. So don't tell me you didn't know, sir. As a corporate-wide scheme to increase inpatient admissions of Medicare, Medicaid, and the DOD's Tricare. Did y'all hear what I said? Medicare, Medicaid, and DOD Tricare. And then you took your ass to Louisiana, and Tony Keck is just as guilty, because when Tony Keck worked for South Carolina, working with the governor in South Carolina, he said that Medicaid expansion was bad, that South Carolina should not do Medicaid expansion. Then he brought his ass to Tennessee and said, oh no, Medicaid expansion is exactly what we need because it's lining your pockets, sir. You all are the people you are fighting against. Depending upon what company you're working for determines whether or not you are going to abuse and take fraudulent Medicaid, or whether you're going to fight against it and put a crackdown on it. Bullshit. Do I even need to tell y'all about the other lies they're telling? Do I even need to tell y'all? Let me tell y'all this. Remember how they told you that our Holston Valley NICU only had 8 babies? Let me tell you the statistics. In 2010, there were 213 babies admitted into Holston Valley Medical Center's NICU. In 2011, there was 227. In 2012, there was 231. In 2013, there was 240. In 2014, there were 260. In 2015, there were 294. In 2016, there was 264. 2017, there were 268. And in 2018 so far, there's been 268. That is an average of 24 babies per month in Holston Valley Medical Center's NICU. So don't tell me about less than 100 babies. Don't tell me about 8 babies, sir. The only reason there's 8 babies there right now is because you started having babies diverted to Johnson City 2 months ago. You got crooks running your stuff. You want to talk about why trauma cares matter? Let me tell you why trauma levels matter, babies. So did you hear him take his ass on WCYB and then say, oh, there's not that big of a difference between level 2 and level 3? He's right, there's not. Do you want to know the difference between a level 1 and a level 3? They want to take Holston Valley Medical Center's trauma care, and they want to take it down from a level 1 to a level 3. Here's the difference. When you're a level 1, you are required to have staff in these areas at the hospital. cardiology, pulmonology, gastroenterology, hematology, infectious disease, internal medicine, nephrology, pathology, pediatrics, radiology, and interventional radiology. That's what you're required to do with a level 1 trauma center, which is what Holston Valley has right now, sir. For a level 3, they're only required to have internal medicine, pathology, and radiology. Dude, that's an urgent care. It's not a trauma center. That's a fucking urgent care. That's what that is. And you expect people coming from Marion, Virginia to be able to get care at a level 3? And by the way, the law says they have to take it to the appropriate trauma center. So check it out. If somebody has heart palpitations, if they have heart issues, if they think this person's having a heart attack, they can't even go to Bristol or Holston Valley if you downgrade them to a level 3, because there's no cardiologist there, sir. Cardiology is only required at a level 2. And you're going to take them from a level 2 to a level 3 in Bristol and from a level 1 to a level 3 in Kingsport. Don't tell these people that this does not matter. These are lives on the line, but you don't care because you have a history of lining your pockets at the expense of both the government, federal funding, and the lives of human beings. How dare you? And then you got your dirty politicians doing your work for you. Just asking, folks. Do we have a problem? Do you think maybe we might be concerned about our COPA? Maybe, you think? I think so. I think so. I don't know who needs to run this healthcare system, but I promise you, it is not Alan Levine and it is not Tony Keck. It is not. You're a criminal, sir, in a healthcare system that deals with people's lives. And that's not me saying that. That's the Department of Justice. I'm just co-signing. So I just wanted to let y'all know. Anybody, anything else? Or should I just drop the mic? I'm done. So there we go. This is what happens when you think you can take advantage of people. God shows up and he shows who you really are. All right. To my folks back home, I am so glad that I was able to uncover some of the stuff that we've uncovered this week. I'm so glad. God does not make mistakes, and divine timing is amazing. You guys got enough ammunition now to make a difference. You got enough ammunition now to get the attention that it needs. You got it. You really do. And to my NICU nurses and the trauma folks who have sent me information, you all have no idea how many of you guys have reached out. Which, let me say this, I have over 1,000 friend requests pending. I don't have time right now to go through all of them. So please just follow me for now, and I will get to the friend requests later. I'm still digging through all the information and all of the tips and stuff that you guys are bringing me. And we'll continue to put it all together. I'm reading a message from someone. So here's what I'm going to say. These are the facts. This is not anything that I'm making up. I'm going to put the link up. Matter of fact, let me do that right now. Ooh. Oh, shit. I moved it over here. Sorry. Here we go. I'm going to give it to you guys. The link that I'm putting in right now is to the Department of Justice. It just was, y'all look, it just popped up. $260 million for fraud over a 4-year period for this particular part of the settlement. Other allegations were from 2003 to 2011. Alan Levine joined HMA in August of 2010. And he was there up until 2014. And he was a VP, senior VP. Hold them accountable. Hold them accountable. All right. That's all I got. I love you guys. I'm going to say this one last time. Thank you all for saving my grandbaby's life. Thank you all for saving my daughter. I appreciate you. And I am honored to have been able to help you get some attention to the issue that you need. I am honored to be a part of the process. I love you all. I mean it. And I will see you when I come home soon. I'm going to get off of here. Be amazing. Be light. Be love. I'm out.